Welcome back. Chronic pain disables more people in the U.S. than cancer or heart disease. Joining me now to talk about chronic pain and pain management is Dr. Paul Lynch and Dr. McJunkin from Arizona Pain Specialists, along with their patient, Fran Baumgartner. We're going to get to you just a minute, Fran, because we want to hear your story. I know you went to see these guys. You feel a lot better now. Thank you both for being here.
Thanks for having us.
You know, we talked about chronic pain. It's everyone I talk to has some sort of a back issue, lower back, neck, something or another. What do you do to help folks?
You're exactly right, Lisa. Chronic pain is so common. And Dr. Lynch and myself both are board certified in pain management. We've done specialized training to treat people who have chronic pain and who suffer each and every day.
You know, we started Arizona Pain Specialists to be the premier pain management program in the country, and we try to do that every day. We have a facility where we do in-house medication management, we do injections, we even have physical therapy in-house. So when a patient comes to see us, we give them multiple treatment options to get them back in their life.
Yeah, because sometimes they think, oh my gosh, I'm going to have surgery, and they think the worst case scenario. Now, you had mentioned earlier that folks, because sometimes I know I have back pain and I can't really tell you what's wrong, I just know it hurts. What do? You come into the office, you're going to kind of give me a little example about what happens.
You know, the key, I'll show on you in a second, I'll use you as an example, but the real key to finding out what's going on with someone, you mentioned your back.
Yeah.
That's the most common reason that people go to the doctor. About 80% of Americans at some point in their life are going to have back pain. And for about 1 in 7 to 1 in 8, it's going to become chronic where you have that pain every day.
Every day.
The key is to make a good diagnosis. You know, a lot of the patients that come to us, including Fran today, will say, we've seen multiple doctors and we're not even sure what's wrong.
Right.
It's been 10 years and I don't even know my diagnosis. So we focus on a diagnosis up front. And we're going to use you as an example. Just
good, okay.
Some basic things that we can do.
Okay.
And I think Dr. McJunkin also brought a spine model. You know, there's probably 5 or 6 different structures in the spine that can cause pain. And there's basic things you can do. So for example, if you kind of bend forward, we'll have a patient bend.
Yeah.
If someone has a pain in that position, we know that the disc is usually eliciting that pain.
I'm good there.
If you start to bend backwards on the other hand, and you have
that
pain,
feels a little bit worse.
that's typically more of the bones where the facet joints go together.
Okay.
And there's other things you can do with just direct pressure. You can feel each bone. And sometimes we'll even elicit fractures in the spine that need to be fixed. Now these are the kind of stuff that if you go to the wrong doctor and you don't realize what your diagnosis is, you can live in pain every day.
Sure. And Fran, was that the case with you? Were you one of those folks that just every day, and you know, it affects every part of your life?
Yes, every part. I was facial pain, and well, first it didn't get diagnosed, and then I've gone to probably 24 plus pain specialists.
Wow.
Yeah, and it wasn't until I went to Dr. McJunkin that I can smile without pain.
Wow, so nobody knew what was wrong. Because you know, who do you go? It's like when we have that kind of issue, it's like you look in the elevator, who do you go to? I guess you go to your general practitioner, and they really don't have the know-how that you really need. So, and you feel great now?
Yeah, but it was my general practitioner that actually found the procedure, looked it up online, and found Dr. McJunkin.
Oh, well then that worked out well for you.
Yes.
And everything is, they figured out what it was, and you're doing well.
I'm doing really much better.
Yeah, that's a great story, because you hear people who suffer, and you know, they don't even realize. I mean, do you find people who just get used to living with pain?
Definitely. Yeah, I think, you know, living with chronic pain, the longer you live with it, the more it snowballs and the worse it becomes. So it's very imperative to get seen early and to get treatment early too. And so Fran is just one of our success stories. And we were so excited, and Fran was so excited that she started feeling better and that she could smile and just kind of get through her normal life so much better.
And laugh. That's
and
great.
I can talk
All right.
without
One
pain.
thing you said that I think is important to key on is you look in the phone book and you know, who do you go to as a pain doctor? There's probably 90 people in the Phoenix area that say they treat pain.
Right.
But Dr. McJunkin and myself were blessed enough to train at one of the top fellowships in the country. And along with working at Arizona Pain Specialists, we also teach and do research at Mayo Clinic here in town.
Gotcha.
So we know what we're talking about. We've done this before, and we've helped lots of people just like Fran, who've seen lots of doctors, and we've been able to help them get their life back.
Well, that's awesome. Congratulations to you, Fran. And glad that you can smile again and feel good. And thank you, doctors, for explaining kind of how that works. And that's good that you can look at people, do those exercises. And if you want more information, there's a lot of information. Go to arizonapain.com, or you can call the phone number you see right there on your screen and get better today.